All right. Hello and welcome to YouTube channel Health Q, the place where our mission is to not only motivate you but help you to move on to the brighter side of the health. First of all, very apologies for last week. We planned to do a YouTube live, but due to some work-related concerns, we had to cancel that. So we are back again here. With me is Dr. Krina. She is also a team member of HealthQ Rehab, and she is a vertigo rehab specialist. So that's the reason we are going to discuss a lot about vertigo. So feel free to ask your questions related to vertigo to us in the comment section below. At the same time, if you have got any other questions related to facial paralysis, cerebral palsy, or any other thing, feel free to ask those questions as well. Right. So first of all, welcome and hello, Dr. Krina. How are you doing?
Hello, ma'am. I'm going good. Thank you for having me on this live and making more about the awareness regime of the vertigo and the vertigo rehab program and its importance in the life of the patients who are suffering from vertigo.
Awesome, awesome. So, Krina, before we start, can you just give a small introduction about yourself to the audience?
Okay, yeah, hello guys, and hello to the viewers. So I am a consultant neurological physiotherapist at HealthQ Rehab, and today I am here to talk about vertigo rehabilitation. I have experiences over the past few years in the vertigo rehabilitation, as well as in the Bell's palsy. Along with it, in the several neurological conditions like stroke, Parkinson's, and then neurological conditions with the diabetic neuropathy in peripheral and several of the spinal conditions as well. So, not only mastered with the neurological science, but also helps the people to same with the motto of health Q rehab to making people to move to the brighter side of the health and making their movements more better on the daily basis.
Awesome, awesome. Right. So, let's start our conversation today about vertigo by understanding vertigo at first place. What is vertigo? What is dizziness? Are they two different things or it's one?
Yeah, so absolutely true. It's on the side where several of the times the people used to use the same words as of vertigo and dizziness, but no, they both are different. The dizziness is where the people feel that I am just having a spinning sensation or a whirling sensation around themselves, and they can see that the room or the surrounding environment is moving, right? But that's what dizziness is all about. But the vertigo is seeing yourself in the stable environment moving and twirling and bending and rotating kind of sensations, which is a vertigo. So the both are the different, and the origin of both the dizziness and the vertigo are different as well. The pathology on both the portions, vertigo and dizziness, are different, and they are being treated with the different treatments as well.
Perfect. Awesome. Let's start with understanding what is the life of a person suffering from vertigo like, what the person experiences or goes through.
Right. So, absolutely understandable. We cannot even imagine how the person's life goes and how the person feels, because it's the vertigo or the dizziness which can't be seen on the other side of the patients, because the vertigo or the dizziness is the feeling which has been sensed by your particular or by yourself, which cannot be even expressed sometimes. So it becomes very difficult on the first side, where the people explains to someone, or the people understands how the person is going through, because no one sees. As in healthy human body, there's nothing going around in the healthy human life, so people conceptuate that this person is healthy and good, nothing has happened to them. But sometimes it's not like that, because the person who is suffering from vertigo and dizziness can only feel how it goes to them. So hence it's very important that to undertake and acknowledge the person who are seeing of the sensory alteration, how they feel of the vertigo. And the second thing is, every vertigos are or the every dizziness, the symptoms of sensory spinning is not only limited or lasting for particular amount of duration. It can last from seconds, it can last 2 minutes, or it can last over the days period of time, depend on what is the condition or what is the pathology behind it. A part of it, it's very important to acknowledge the duration, the episodes, the frequency, and how much it's the continuous the symptoms are. So living with a vertigo is a very difficult. A part of it, the person also feels, whenever the person so I'm taking it on the other side. So whenever the person feels this kind of sensations, first of all the person becomes panic, the person becomes stressed, and they sometimes feel depressed about how is my life going, because they can't able to do their day to day activity task. And it's very difficult to do the day to day task, like bending down your head for seeing mobile phones, then taking a shower and look up where you need to look up and have shower. So it becomes difficult for them to do all these activities. At the same time, the person has doubt that when I first woke up and I close my eyes and wash my face, hence where the first the person or the patient faints off, or the person collapse. And thence where the person finds that this is what something which is not there. And with the early morning or the morning onset of such kind of episode, can make the patient more panic, what has happened today. So there are multiple onsets, there are multiple triggers which happens when the initially vertigo is being diagnosed. But at the same time, there are certain chronic patients or the patients who have long lasting vertigo or the long lasting symptoms of dizziness, where the person is got to into the habituation of making or modifying their lifestyle and living.
Awesome. Right. So there is a lot of buzz, you can say, around this term called neuroplasticity as a way to work on vertigo, right? So what exactly is neuroplasticity, and how neuroplasticity plays a role in vertigo rehabilitation?
Right. In this new era, the word neuroplasticity is being widely termed, which is being used among the patients with the neural or the nervous system disorders. So, neuroplasticity is being termed as the natural phenomenon of the nervous system, which can help the nerves or the neurons to give the sprouts, which can be in the different form, to give either a sprouts by making new synapses, or by taking over the compensatory functions of the neurons which are being damaged or which is destroyed. So hence this helps the new formation or the new learning of the person to do the certain things which can be adopted or which can be compensated over the period of time. But it's not an quick or an immediate process. The neuroplasticity is a lifelong process, where it can be associated with the long term rehabilitation in case of the person who are suffering from neurological condition.
Right. Right. So, what exactly? Let's say if we have to talk to a person suffering from vertigo, how we can explain them that this is how neuroplasticity is going to help you.
Okay, yeah, right. So, as we understand the vertigo and its pathology behind the causes of vertigo, there are different causes. One is the peripheral cause, and the second is the central cause of the vertigo. In the peripheral cause, the damage is inside the ear, where there are certain structures which gets damaged, due to which the vertigo is found. And the second thing is there is something as in central cause. So it means that wherever the brain is responsible to process the balance, to process the sense of the body positions, and third is to sense the feedback from your head, neck, and your body, where the body is responsible to move, quickly turn, standing, walking, and etc. So, hence, in the areas where the body is being controlled inside the brain, so that area gets damaged. So because of the certain areas, at the peripheral level also the neuroplasticity works, and at the central level also the neuroplasticity works. So it has been evidence based proof that the central plasticity or the central neuroplasticity happens faster rather than the peripheral. But at the same time, the ear, which is located very near to the brain, also has a capacity to work faster in the neuroplasticity. So the cranial nerves also has a good plasticity rate. A part of it, the neuroplasticity in treating the patients of vertigo helps in few adaptation, because the gaze stabilization practices, the habituation practices, and the adaptability practices is being addressed to the patients who are suffering from vertigo. And these are the three basic principles of the vestibular rehabilitation, which can help the person to overcome through this vertigo symptoms over the period of time, to habituate the triggers or the symptoms of the vertigo which is patient suffering from. And
Okay.
hence the neuroplasticity works at the different levels of mindfulness, different levels at the intentions of self healing, the choices of the treatment, the person's focus, person's belief, and person's emotion. So it works not only on your bodily structures, but it also acts at the mental level or the psychological
Mm-hmm.
factor also.
Mm-hmm. Perfect. Right. And are there any myths that people have around vertigo that you would like to just debust?
Yes, yes. So there are multiple myths and facts. So out of which the first what we covered was whether the vertigo and dizziness are same. That's absolutely one myth, because the people are correlating and alternatively use these terms. Second myth is vertigo is not curable, where it's not true. Vertigo is absolutely curable, but it takes a longer period of time if you want to fix it, because it's a long term process as the neuroplasticity works on. The second thing is, there are a few concepts that vertigo only happens to adults. So it's also not true. Vertigo can happen to an pediatric child, also can happen to adult also, and can happen in the geriatric population, which is an old age population.
Hmm.
So vertigo can happen in all the range of ages over the period of time. A part of it, the major concerns are vertigo can be only treated by medicines or only by surgeries or only by physiotherapy. So it's not true. Vertigo is in combination therapy of all three, where the physical therapy or the physiotherapy plays a major role in helping the patient to overcome and habituate the practices of their self-being.
Hmm.
And few myths like it can only happen inside the brain, or it can only happen where there is height concern. So it's not always a height which aggravates it. There are certain different triggers behind it. Sometimes migraine can be also a trigger. Sometimes even the pregnancy can also be a trigger, or even certain drugs can also be a trigger to vertigo.
Right, absolutely. And which is the common age group or population who are more at risk of developing vertigo?
Okay. So the first and foremost, vertigo can be highly being found among the adult group of people. In the females, majorly with the after they took prolonged hypertensive or hyperdiabetic medications. A part of it, the very teens age group of pediatrics also suffer from vertigo, and these are the few gaps and pieces in the age of where the commonly
Mhm,
population is being found.
mhm,
And
mhm,
also with the late adults, where the bone density, bone porosity happens, and because of that also things get damaged and can trigger the labyrinthine damage. And also the sclerotic, the arteries which get sclerosed. So because of
mhm.
that, the blood circulation doesn't happen correctly, and because of it, the structures which is responsible for balance gets damaged
Mhm.
and causes vertigo.
Right. And how about pregnancy? What's the link between pregnancy and vertigo?
Right. So, not major females have suffered from, but 1 in 10 or 2 in 10 is the prevalence where the vertigo is found among the females. This is being seen because of few reasons, because of the psychological change, because of the musculoskeletal change and because of the hormonal change present inside the female human body. First is if we talk about the physical or the musculoskeletal part, where the proprioceptive feedback or the proprioceptive receptions becomes less, becomes deficit. A part of it, because of the concept that only we have to sleep on left side. Right side, there are cases and there are prevalence where on the right side, the BPPV, because of the only sleeping on the left side, the right side otolith gets dislodged from it, and right side BPPV is more common. And a part of it, in the pregnancy, the hormonal influence is very high, as relaxin hormone, and the second is progesterone hormone. So because of it, the arterial dilatation and the circulation becomes impaired, where there are certain chances to labyrinth become hemorrhagic, because of which the vertigo is common amongst the female. But at the same time, this period of the pregnancy vertigo is for short term. It's highly been observed in the third trimester, and a part of it, it gets resolved once your body becomes habituated to the process and reduces its weight and comes back to the normal structures.
Hmm. Right. So let's move on to the treatment part. And what are the tips or what are the ways with which we can effectively reduce the symptoms of vertigo?
Okay, right. Vertigo is being divided, or vertigo rehabilitation. So, why there is why there is not a rehabilitation term associated with it? Because majority of the time people take it very lightly. That once the medicines get stopped, the people don't tend to follow it for the long time, because it can trigger again when your body is not adapted to it. First thing is, vertigo treatment is for longer period of time. The longer in terms means till the time your body is adapted. Now, no body is same, so that we cannot come to and remark that this number of sessions or this number of treatment duration is only required for you. Rehabilitation is inclusive of a few components. First is, if the patient is suffering from any canalith or any crystal dislodgement, displacement structures. So first is the maneuvers which is being done by the physiotherapist or by the surgeons or physicians with the patient. That's the first, where the supervision is very much required in the initial phase. Second, can be progressed towards the vision or the visual aspect of the vertigo rehabilitation, because people have blurry vision as a symptom. So,
Right.
second inclusion is the gaze fixation and the gaze stabilization practices. The
Mhm.
third is majorly inclusive of the balance and the body training, where the body is being trained under few circumstances, where the balance or the patient's body is being challenged in the terms of stability. The
Mhm.
fourth component is adaptation and habituation, where the triggers are being found out, and along with the triggers, this is being treated in the
Mhm.
patients with vertigo. So depends upon the patient what is their trigger.
Mhm.
We will
Mhm.
work it in a customized and personalized way,
Mhm.
and
Mhm.
then it can be progressed in their protocol. And after everything, it comes your relieving your anxiety and stress. So it is much more important, not only addressing the physical component area of the body, but also the mental well-being. In terms of mental well-being, anything which includes your creativity, say suppose like arting, crafting, drawing, cooking, so this can be inclusive of it. There are certain techniques of calming down or reducing the stress, like light therapy or a dark room therapy, like a music therapy, yoga, meditation. This can all help. A part of it, it has been researched as tight
Hello. Guys, I think we have lost Dr. Krina. I think she'll be joining in some time. Let's give a small pause and then start again. Hello. Hello. All right, guys. Meanwhile, if you have any questions for me as well, please feel free to type in so that I can help you out. I can answer your questions and solve your questions related to facial paralysis, vertigo, Bell's palsy, cerebral palsy, etc. You must be thinking I'm saying facial paralysis and Bell's palsy separately. Both are different things sometimes, so you can ask that. And any other questions you would like to ask, feel free to type it down. Dr. Krina would be joining in a very short time. I think there is some internet connectivity issue due to which she had to drop off. All right, so she's here back.
Sorry.
Yes, no problem, no problem. Please carry on.
Yeah, so I was talking about some calming down techniques for the patients who are dealing with the stress.
Right. So let's break this down about people who have a lot of fear associated with vertigo. That they might fall, they might land up into some other serious condition, or they might land up into tinnitus sometimes. What are the tips that you would like to share with them?
Right. So, as it's important to understand the mental well-being as well, the person with the vertigo who has the fear of fall, or sometimes they have the fear of vertigo symptoms which can come back again.
Mhm.
So,
Mhm.
it's absolutely true. This is the part of life, but a part of it, it must be taken into consideration that this is the vertigo is not limiting you.
Mhm.
You must address yourself a guilty free that whatever you are doing you are managing yourself into a right direction and treating yourself as a best with the medicines, with the best physical rehabilitation, with your regular and consistent physical practices, not only your physical but also your mental practices. This is how the patient will feel over the period of time fearless about the symptoms which can come back to you.
Right, right. Very true, very true. And how about sinusitis? I know this is like very much not related to regular anxiety, and tinnitus are common symptoms associated with vertigo, but there are many people who link sinusitis with the vertigo as well. Is there a link at first place?
Yes, there is a link of it. So it's being considered as in something which can be ruled out. It's not always the sinusitis vertigo. There is a term named as sinusitis vertigo, but it's
Mm-hmm.
not always associated with it. So sometimes the people are being diagnosed with the sinusitis vertigo who has the frequent vertigo, frequent sinus around the nasal area and around the neck area, where what happens as the sinus are connected with one canal which connects in the middle ear. This
Mm-hmm.
canal has started forming lot of mucus or a lot of um, what we can say mucus, sticky secretions inside the tube. So this secretions will not allow to drain out because of constant inflammation inside the sinus. So what
Mm-hmm.
happens? This infection spread out over the tube, which is known as Eustachian canal, and
Mm-hmm.
this canal is responsible for infecting the inner ear structures as well. So
Mm-hmm.
hence, as this structures gets inflamed, it causes a temporary or it causes a short period of time symptoms, which can
Mm-hmm.
be termed as vertigo, sinusitis vertigo. A part of
Mm-hmm.
it, not only sinusitis, but sometimes migraine is also linked with the
Mm-hmm.
vertigo, which is known
Mm-hmm.
as vestibular migraine.
Mm-hmm.
Also, a few conditions like associated with middle ear,
Mm-hmm.
the muscular spasms are also associated with it.
Mm-hmm.
Sometimes even the blood pressure fluctuations, dehydration, or sunburn can also correlate with
Mhm,
the vertigo.
mhm,
But they are not actual vertigo; they are a temporary short phasic vertigo where the primary cause is something else. Because
mhm,
of their dysfunction, the vertigo comes into a
mhm.
picture.
All right, makes sense. Makes sense. I think yeah, you were able to break down a lot of myths and gave a lot of clarity about vertigo that usually people lack. And I'm glad that we had this conversation because there are so many. I think still there are a lot of things like if we get time, we can talk and talk and talk forever on vertigo, and the topic is so vast. But yeah, what we tried to do today in this session was to give you an overview and give you an understanding at first place of vertigo, what are the common myths, what is its link with neuroplasticity, the most in concept these days, and also what are the associated symptoms like sinusitis, as she's mentioned, anxiety, she mentioned, how dizziness and vertigo, both of these two things are different, and the cause also comes from a different location. So our entire intention was to make sure that we give you an overall breakup and overall understanding of these different components of vertigo. I hope you all found this helpful. And if yes, make sure to stay tuned with us. We also have a vertigo rehabilitation program, which is completely live on our platform, which is www.healthqrehab.com. Feel free to take a consultation at first place if you're suffering from vertigo, and then later on decide whether you want to go ahead with vertigo rehabilitation or not. But at least start that first step, because vertigo can make your life worse, can impair your quality of life, can impair your functional independence to a lot of extent. But the solution is simple if you see, in long run. It's just that it requires a consistent effort, and it requires someone who knows what to be done, right? So that's where our entire goal is. So I hope that we were able to help you out through this. If you have got any questions related to vertigo, feel free to reach out to us. Our website is www.healthqrehab.com. From there you'll get all the contact details, phone number, email id, etc. You can follow us on YouTube, you can follow us on Instagram, you can just send a DM to us. We will try to help you out for sure. On that note, let's end this live video session here, and I'll see you again in next week's live video session, which would be on another topic, another different concept and new concept in physical rehabilitation. Till then, thank you so much. Bye bye.